mentality कि एक बारी डॉक्टर ने बोल दिया कि आपको हार्ट फेलियर हो गया है, my life has ended now, and they give up on the hope.
It's a feeling of doom as I call it. क्या होगा अगले जाके, क्या पता मर जाएंगे.
Yes.
I mean, ये डर मुझे भी पहले था.
So what do you think could be the really alarming symptoms?
Heart failure in young is often asymptomatic. So the last patient we transplanted is just 27 years.
How successful are these transplants though?
So again, so it depends on when you are doing. If you miss the bus, outcomes are bad. If you want to do a transplant, most cases the chance of living beyond 1 year is about 20%.
Without the transplant?
Without a transplant.
Okay, ठीक है, transplant हो गया है, but what after that? Does the life feel normal?
So I think the biggest barrier to transplant is immunosuppression.
People have this mentality also कि don't do it from India. India में तो कुछ अच्छा होता नहीं है.
If you were to look at risk perspectives, coronary artery disease probably has 1/5 the risk of heart failure.
1 in 5 people will die because of the cardiovascular disease, which claims more lives than cancer and chronic respiratory diseases combined. Yet, 80% of the heart diseases and stroke cases don't miss a beat. Today, on another episode of Beyond the Pill, we will be talking about heart failure, and I am your host, Dr. Chetna. Let's dive deep into the topic. Joining us today is Dr. Ayan Kar. He is a senior consultant interventional cardiologist and a lead in heart failure services at Narayana Health RNT Hospital from Kolkata. Let's give him a big welcome and understand from him that what are the recent advancements in the field of cardiology and why holistic approach is important in the management of heart failure. Welcome to our show, Doctor, which is Beyond the Pill. And thanks a lot for getting a time from such a busy schedule where you have been doing such advanced interventional cardiology procedures, and I think it's difficult कि ये सब चीजों से टाइम निकाल कर इस प्रोग्राम में आप आए, बात किया हम लोगों से और करने वाले भी हो, and to help us spread awareness about the same.
Thanks so much. Thanks for the invitation.
So let's to start with, where could people actually find you?
So I basically work out of a large hospital. It's a quaternary care hospital. So it's not a tertiary. It's a quaternary care hospital based out of Calcutta. We are based at Narayana Health RNT. It's one of the largest cardiac hospitals in Calcutta. We have a cath lab complex, probably the only one in the city with 5.
Wow.
And we have a lot of things going on in the hospital. So it is sort of one-stop shop for advanced cardiac care.
I feel really grateful that I got this opportunity to sit in front of you.
No, that's not. It's a pleasure to talk.
How did you get motivated to get into this, first of all?
Well, that's a different story altogether. So, see, I basically trained in cardiology. So I was going to become a garden variety cardiologist, if I would say. But then, by the time I actually passed out, and it happens that you're still looking for what is called your calling.
Correct.
So and it often tells you, and it's not like I'm the only cardiologist in the country. There are plenty more actually. So it's such that when I did, so I think a lot of credit goes to Dr. Shetty himself, our chairman. So I think there was a time when he called me and he said that I think the next decade belongs to heart failure, and that is where you should invest. And so that's how it is. So I think it was sort of a nudge, and it was sort of
calling, as you said.
Well, I'm yet to find my calling, I would say still, but I would say that I'm sort of invested in heart failure at the moment, and that is where we are looking at things. I think therapies are expected to come in the long run. We still have a lot of therapies going on. It is something that we really need to look into because it's a big disease, and it is still one of the causes for very large mortality and morbidity in our country.
Yes, correct.
So, which is why there is a lot of work which needs to be done.
So why do you think, what is the reason that Dr. Shetty came up with this key next decade belongs to heart failure?
Well, sir has always been somebody who's always been able to see some things far beyond what we normal people can see. So he sort of foresees the future at least a decade or 2 decades earlier. So I think he's always been a front runner as far as cardiac science is concerned. So I think he definitely saw that there were probably, insights which he has, which I don't have, of course, which makes him believe that the next decade would probably belong to heart failure if you look at cardiology.
Is it because of the current lifestyle people are having or increasing incidences of heart failure? What could be it? Or lack of awareness or lack of screening? Or is it that patients don't really feel that there is any chance of improvement once they're detected with heart failure?
So you're absolutely right. I think what's really got better is diagnostics. What wasn't there before was awareness. and what's improved is therapeutics.
Yes.
So which is why I think this was lacking. So a decade back, I think we didn't have the kind of drugs we have today in heart failure. So I mean, we're not just looking at therapeutics. I'm saying that I can write out 4 drugs to you if you have heart failure, and you are likely to get better. We say that if you are able to tolerate 4 drugs, the chances are that I'm going to increase your lifespan by 5.5 years, which is no small job.
Correct. Mentality कि एक बार ही डॉक्टर ने बोल दिया कि आपको हार्ट फेलियर हो गया है, so they consume it in a way कि okay, my life has ended now, there is nothing left, and I have really less time to live, and they give up on the hope. But what they really need to understand कि heart failure doesn't mean कि दिल ने काम करना ही बंद कर दिया है.
बात ऐसा है ना कि since I work probably a little more in heart failure alone, ये डर मुझे भी पहले था पर अभी कुछ दिनों बाद ये डर चला गया अभी. So I can explain that fear that people have when they come to me with a diagnosis, as I often call, is called a label of heart failure on their forehead. It is often reminiscent of, it's a feeling of doom, as I call it.
Doomers.
Doom मतलब कि क्या होगा अगले जाके, क्या पता मर जाएंगे. जिंदगी तो खत्म ही हो गया, इसके बाद और कुछ बचा ही नहीं. Depression sets in and all that. So you're looking at a lot of issues. So I think a great part about my work as a physician is not just to give medicines, it's also to motivate people. So see, the intention is that there are parts to a heart failure physician which he can contribute to. Is not just medicine, it's about a wholesome improvement of the patient.
Correct.
So that often includes motivation, it includes improvement in diet, it includes in social skills, it's in rehabilitation. Rehab is something that we barely talk about.
True.
Specifically a large part of heart failure is about rehab.
Correct.
Because these patients are mostly being told that, ऐसा लगता है जैसे कभी-कभी it's not about, I'm not saying that, doctors are wrong, but the general perception is that once you get a diagnosis of heart failure, you're expected to stay within the 4 corridors of your house.
True.
You can't go out. And it's like, even if you were to go out on the road, you could die anytime. But the intention is, at the same time, we also need to understand that probably one of the best friends of heart failure is exercise.
Yes.
And that always doesn't happen at home.
Correct.
The only thing that is probably not stressed on is supervision, which often is lacking in our country. But then there are a lot of exercises which are safe.
Yes.
They're absolutely safe. You could do them at home. You need barely any equipment for that.
You need motivation.
Yeah, that's all you need. So you need somebody to tell you that, why don't you try this?
Correct.
See if it benefits you, and then you come back and let me know. And often I think it needs social skills, as I said. So, we being social animals, it's very important that you talk to people in groups. So often I get my heart failure patients to talk to each other so that, they can, so if somebody's benefited from a certain intervention, he's likely to promote that to another person.
Correct. That is.
It's like, बात ऐसा होता है कि chia seeds is a big kind of thing in India today. सब लोग chia खा रहे हैं, इसका dust खा रहा है, ये खा रहा है, वो खा रहा है. But that's purely because word of mouth.
Yes.
If the same thing could be done for exercise and heart failure, I think we won 50% of the game.
Yes.
We don't need a lot of things.
Yes. Best medication is, I feel, the lifestyle modification part.
Yeah, and nowadays we're talking about longevity, and also the cornerstone of longevity is exercise.
Yes, that is correct. So being a physiotherapist, I completely support it. So I have seen 2 kind of patients, okay? One who had a sudden heart failure, who was on ventilator, who got a heart transplant done, and who's taking life very seriously now and following all the lifestyle modifications and is getting back to life and trying to improve the quality of life. Other side, I've seen one more patient who's gone through the heart failure, got himself treated, got out of emergencies, back to life, but again started his tobacco, smoking, everything, and now is in and out of the hospital, but still not taking it seriously. So what do you think, why there is so much lack of, taking your health seriously, or why people are not actually thinking it, how dangerous is this?
So just to give you a perspective, so let's say there are 2 parts of cardiology we often talk about. One is called heart attack, one is called heart failure. So heart attack is typically, the kind of thing where we call it a myocardial infarction. So basically one of your coronaries get blocked and you have a heart attack and you come to the hospital. The other part is heart failure, which is basically your heart not pumping enough. So it's basically sort of just not producing enough blood flowing into your vessels. So the intention is that if you were to look at risk perspectives, coronary artery disease probably has 1/5 the risk of heart failure. So the risk with heart failure, so the chance, let's say for a person diagnosed with coronary artery disease, and let's say with whatever medicines we have in place today, I mean, the chance of him dying is one-fifth of that of a patient with heart failure. So the chance of dying with heart failure is
Yes.
5 times more. So it tells you why it should be serious.
Yes.
As far as the decision as to whether he's going to take it serious, it's about perception. So I think that is some place where I think a lot can be done by social media.
Health
It can be done by awareness. It can be done by cardiac rehab, by group therapy.
Right.
So often, so as I told you, this thing to getting rid of this fear is often because people are out of despair because they know that okay, कुछ नहीं होने वाला है. ये आगे जाके भी तो मरने ही वाले हैं.
Correct.
So why not जी लेते हैं जितने मेरे पास वो स्मोकिंग करके अल्कोहल लेके जो भी करना है करके जी लेते हैं. नहीं तो बोलेंगे बाद में मरने के पहले कि भाई जिए भी नहीं मर भी गए ऐसा है.
Correct.
But then that conception is something that is a very personal one. I think that's not something that you and me can really take a patient out of. But I think that often needs a lot of improvement as far as social skills are concerned, rehab is concerned, counseling is concerned.
Okay.
So that is all, I mean, very much lacking in India. It's lacking. Why? Because the concerted efforts are not there, number one. And number two, a lot of things, nobody's there to pay for all of this.
Actually, that is the biggest issue.
So cardiac rehab is something that's not reimbursable by most insurances, whereas it should be.
It should be, correct.
So if you don't have cardiac rehab, so which is why nobody takes it seriously. No,
So
we've spoken to a lot of insurance
so that
companies,
we could really
and
tap into it.
It's
and
not something that's happening at the moment.
We could make it happen.
Yeah, we're trying. We have an online platform which is already trying to do that, but then our results as of now are just lukewarm at the moment because nobody wants to pay for rehab.
See, that there, the awareness and the importance actually, they don't want to pay for it because they don't find it as important.
No, that's because they don't see the results of it. So you will get to see the results of it as more and more people take up rehab.
Okay.
So the intention is that, let's say you were working in America today, I think your rehab comes as a part of your package, as part of out-of-hospital care. So the moment let's say you have had an MI or you've had a heart failure decompensation, it's not optional. It's something that you do. Why do you do it? Because Medicare wants it. So insurance wants you to do it because they don't want you to get admitted again.
Correct.
Because more times you get admitted, they'll have to pay.
Yes, that's like
but the intention, that whole understanding is lacking.
That is where we have to work upon exactly. So tell me one thing, in the patients who are coming to you, how do you start the treatment process? Because we have sort of come to know ki heart failure kaise hota hai and what exactly is it. But like in cancer, we keep telling that early detection, it will help and you're supposed to detect it early. When it comes to heart failure, I think same चीज apply होती है कि अगर आप जल्दी डॉक्टर के पास जा रहे हो, जल्दी symptoms समझ रहे हो, उतना ही better आपका quality of life है, उतना ही better prognosis हो सकता है.
So let me put it to you this way. I don't know about cancer, but I can tell you this about heart failure. With the current level of drugs available, if you're actually able to pick them up early, there is probably a 20 to 30% chance that you can actually cure heart failure.
Cure.
So, I mean, that's in inverted commas. I mean, there are drugs which are available in the market which weren't available probably a decade back, where we've seen LV functions go back to normal. So I've taken patients off transplant lists. They've gone back to normal lives, and that's possible. So let me put you this way. So if you're able to actually evaluate heart failure early on and pick them up aggressively, there is a small chance, but the chance is not zero, right? That you could still have a reversible cause for heart failure.
Okay.
So when I say that, but it needs to be aggressively evaluated. So remember, you cannot come to us with a disease for more than 5 years, and when your disease is burnt out, and when you are typically what we call is end-stage heart failure, where therapeutic options are very limited, and it's not going to get anywhere.
So what do you think would be the really alarming symptoms?
So the alarming symptoms, I think, is so there are multiple symptoms of heart failure. So often the biggest thing again, so let's say heart failure in young is often asymptomatic. That's the biggest problem.
Yes.
So the ability to compensate for heart failure is more when you are young. So I often find these patients, so the last patient we transplanted, he's just 27 years. So the question is, he's been sitting with it since he was maybe 17 or 18, and he's compensated very well all the way through. That's it. So the question is that, let's say if we hadn't picked him up early on, we wouldn't even know that he would need a transplant.
Correct.
Because remember, transplants can't be done out of thin air. It's not like कि आज आपका खराब हो गया हार्ट, आपने आ गया और कल परसों आपको हार्ट मिल गया, transplant हो गया. There's a lot of preparation involved.
Exactly.
So the logistics defy doing transplants in acutely ill patients, and your outcomes are also extremely poor in acute ill patients. We call them Intermax 1, status 7 करते बाहर के देशों में. These are patients who are sinking. These patients, they never do well.
Okay.
The chance of mortality in them is more than 50%.
How successful are these transplants though?
So again, so it depends on when you are doing. So again, as I told you, we don't want to miss the bus. If you miss the bus, outcomes are bad. So it's the same reason why you should get to a specialist early, get evaluated early, make sure that you're going through the protocols, doing the tests. Often people ask us as why do you want to do these tests? Why do you want to have these drugs? They're expensive. But I would probably say that if you were to do a cumulative analysis of, let's say, drugs and tests in a year, it is nothing compared to one hospitalization. One hospitalization can literally drain you of finances like you've never seen before.
Correct. That's like a better way of putting it.
Yeah.
And when we talk about transplants, sir, we all know that, major problem over there or major challenge we face is the organ donation. So what's your take on that?
So see, unlike other organs, so heart हम लोगों का एक ही होता है. We don't have two kidneys, two livers.
Yes.
So, but at least for kidneys and livers, you can still do a living donor. Let's say I have two kidneys, I can give one to somebody. But that is not possible for the heart. So heart is typically a program which is dependent on what we call as cadaveric donations, which means somebody else has to be technically declared brain dead for whatever reason. And that person, so that is one challenge, that you have to be brain dead, but at the same time, all your organs are mostly functioning well.
Okay.
Number two is that the patient relatives need to consent for organ donation.
Okay.
So these are biggest hurdles as far as organ donation is concerned. So because of lack of awareness, general social perceptions that, I've heard peculiar ones that, what happens if, you go to heaven without your heart and your lungs and your pancreas and your kidneys. So the thing is that those perceptions need to be broken.
Yes.
Why? Because generally one organ donation does not just help one life. It's close to 7 or 8 lives you're actually saving, because you're donating 2 kidneys, 1 liver, 2 lungs, 1 heart, often pancreases, often gut loops. Nowadays we're doing hand transplants, leg transplants, corneas. So there's a lot going on. So the scope is limitless.
Okay. When the patient opts for such kind of transplant, for them obviously it's ये है कि मेरे पास अभी option नहीं है, I have to do this. But then it takes the toll, mentally तो होता ही है, financially also it's quite expensive. So how much is it helping us in recent times?
So I would say, if you had to put a number to it, let's put it this way. So let's say in patients who really need transplants, if you want to do a transplant, you have to understand that most cases the chance of living beyond 1 year is about 20%.
Without a transplant. Okay.
But when you do a transplant, you're probably improving that 5-year survival to about 80%. So remember, the intention is why I'm showing you these numbers is that it's not like it's a foolproof method. I'm not saying that it is something that's gonna make you live for hundreds of years. That's not the intention.
Correct.
But the intention is that at least I would say 7 or 8 years looks better than 1 year. In 7 and 8 years, maybe you could achieve far more. And there's a small chance that in coming years, things might improve further. We might actually be able to advance science. Even transplant could look better.
So I'm getting a lot of interest and I want to dive a little deeper into this कि ठीक है, transplant हो गया, everything went well, but what after that? Does the life feel normal, or the patient has to take like extra precautions and extra care lifelong? The patient has to continue that way.
So I think the biggest barrier to transplant is immunosuppression.
Yes.
Which is basically you're trying to put in somebody else's organ in somebody else's body.
Right.
And so in order for the body to tolerate somebody else's organ, you have to give drugs which suppress your immunity. The byproduct of which is infection. So there is always this in the back of your mind where there is infection. But it's important to understand that current immunosuppressants are such that the chance of that happening is low, and we have multiple ways of managing that. So transplant immunology today is a specialty on its own.
Okay.
So it is something that is in its own right is a specialty, and it goes to the effect that and drugs are very nice and they're very good and they're well appropriate, and I think it's only going to get better in the long run. With the kind of advances you see in cancer,
yes,
I think in the long run, transplant immunology is going to get only better. It's not going to get worse.
Okay, and people have this mentality also कि don't do it from India. India में तो कुछ अच्छा होता नहीं है. If you really want to do it, go to abroad or go to US maybe and get it transplanted.
See, I mean, so this is a perception we'll never be able to break, number
Correct.
one. So number two, I think only our numbers can speak for that.
Yes, correct.
So you have to understand that the economics of getting a transplant done in India is far cheaper than getting it abroad, number one. Number two is that by doing so, you're also, I mean, so these programs need to evolve. So if the Indian government is planning on Atmanirbhar Bharat, so there's no reason why these kind of specialized services cannot evolve in India. Let's say, to give you an understanding, so my hospital is the largest let's say kidney transplant center in the whole of Southeast Asia.
Oh, wow.
So, but then that doesn't mean that that people don't go outside. So people can go outside. That you won't be able to stop. But the intention is that we need to invest it in as a therapy, so that at least people who we would expect not to live for beyond 1 year, we can at least prolong lives at the moment.
That is true. That is
and
true.
As I told you, not today. So I think in the long run, you would probably, what could happen, we are liking to work around barriers. So here immunosuppression is a barrier. So our current workaround around that is an artificial heart. So an artificial heart is something that works like a transplant. It is an implantable device. It works on batteries. It sort of buys you life exactly like that of a transplant, but of course you're tethered to a power cord. So it's called a left ventricular assist device. We call it an LVAD. So
artificial heart, as in it's a device.
It's a device. It's a device which is implanted into the heart, and it sort of works on the same way as your heart would normally. And what it really does is it basically takes blood from the left atrium and pulls it into the aorta. So it just sort of replaces the left ventricle, exactly the one which is problematic in heart failure.
Okay.
So what the good parts and bad parts is, the good part is you sort of have a workaround of immunosuppression. You no more need immunosuppression.
Okay. So this artificial heart, jo bol rahe ho, it is with the patients who are not going for transplant.
So technically, we reserve this today for patients who are not getting a heart.
Not getting a heart. Okay.
So let's say often, you want a heart, but you don't have organs available. Patients are sinking. You need to do something. So a VAD seems to be an appropriate. We used to call it a bridge to transplant before, but nowadays the VADs have got so good that they are becoming bridge to destination, which means they're acting like a normal heart.
Wow. Okay.
So we have hearts which almost we have a lifespan of around close to 10 years. So previously we used to do this only for elderly patients, where because elderly patients are not going to get priority for organs. Often younger patients get it before elderly patients get.
Okay.
I mean, if you go by the way it is listed in our country. So nowadays what we are doing is and since I told you most of these organs, they don't last more than, even if you do a transplant, it lasts about 10 to 15 years, not more than that. So often what we do is we put in a VAD first and maybe look at doing a transplant later.
Okay.
So that you're doing a cumulative of, let's say, 10 and 15 on the VAD and maybe another 10 and 15 on the transplant.
Okay.
So you're looking at a lifetime management of about 30 years.
Superb.
Yeah, so that's something I'm probably looking into the future maybe. But of course this comes with a lot of costs involved. It's not easily available. I mean, it's easily available, but unfortunately it's economically not possible for everybody to afford at the moment. But again, to put to that, we have the indigenous VADs coming up. In the long run, IIT Madras, I think, would come up with VADs which can be produced within the country. So I think, and that would probably bring down costs. So I said it's a very evolving space.
Yes.
So you probably just need to keep lookout for things to work.
Correct. And as well, for the patients who doesn't want to take such interventions, what about them? How can they avoid in and out of the hospitalization?
So that would it depends on what kind of stage of heart failure you are in. So typically if you're early stage heart failure and if you're doing well on medicines, there's no question of putting you on a transplant or a VAD. It's out of question. If you're doing well on medicines is your go-to. Whereas, so this is reserved. So what I'm talking about is called advanced heart failure. So that is where most medicines don't work. So that's reserved for maybe 10% of the subset of patients, not more than 5 or 10%, I would say. So most of these are genuinely on drugs.
Okay.
So it's going to be medicines, it's going to be exercise, it's going to be wellness, mindfulness, it's going to be yoga, it's going to be nutrition. So that's what's all about heart failure. So heart failure is all about holistically treating a patient. So you're treating a patient from top to toe.
How the approach is supposed to be? So
what I find lacking currently is that, most of people feel that it's sort of all to do with the heart, but it's often not. So you need to look beyond the heart often. So, as I said, you need to do nutritional counseling. So let's put it this way. So often I have heart failure patients who they're they shouldn't be having ghee, they're not having carbohydrates, they're not having various energy dense foods, which often is kind of restricted in patients who have heart attacks. But as I told you, the general misconceptions, they are not the same.
Okay.
So heart failure is a catabolic state, which means you're breaking down more often. So your heart is having to work far more than it should for you to stay alive. So it needs firewood. So it's like trying to run a bike without fuel.
Yes.
It doesn't work.
Correct.
So the concept is very simple, that in being a catabolic state, you need to eat. I mean, that eating is sometimes it's going to be calorie dense, and calorie dense is what? So you're looking at ghee, you're looking at good fats, you're looking at proteins, you're looking at eggs, you're looking at carbohydrates, because they're all part of a nutritious diet. I mean, we fail to make people understand, because they feel, oh, the previous doctor ने तो बोला था ये सब कुछ खा नहीं सकते, कोई घी अलाउड नहीं है, कुछ नहीं, अंडे नहीं खा सकते, आप तो खाली वो जो वो उबला हुआ चीजें खा रहे सारा दिन, वो that's not how it works. I mean, that's not appropriate nutrition.
Correct. So the patient has to understand what is right.
So that is what is right is something. So we as a community also, we need to evolve.
Yes.
I'm not just saying that it's the lay people which is the problem. We as a community need to evolve. I've seen even some dietitians in my own hospital having trouble understanding that heart failure diet is a totally different diet. So often patients who are waiting for transplant, we often feed them chips, potato chips. Yeah, potato chips, unsalted potato chips. Why? Because they're dense in calories.
Right.
You need to give them a lot of calories. You need to make sure that they're up on their nutrition, that they're getting 4 eggs a day. Some people ask, 4 अंडे खिला रहे, पहले तो ये मना कर दिए थे आप, अभी आप बोल रहे 4 खाएं. मैं बोला भाई हम लोग को भी मना किए ही नहीं थे.
Correct. So that is why, on such programs, we need such doctors like you to come and speak for us.
But the problem is, a lot of people want to be aggressive only on the medicines. I said, that's fine.
Correct.
That is something that we as a community, we know.
Yes.
But there are subtle parts to heart failure which is there. It's out there in the wide open space, but it's just something we tend to ignore. Why would you ignore nutrition? Why would you ignore exercise where it has a 50% chance of contributing to your overall wellness?
That is true.
So when you eat good food, you feel good anyways.
Yes.
So आपको मान लीजिए रोज दिन आपको उबला हुआ चावल, उबला हुआ सब्जी देते बिना नमक के.
Correct.
I mean, that's torture.
Yeah.
I mean, that's who would feel better after that? Nobody. You'd be rather despair. You'd be desperate. You'd want to die. Of course.
Yeah, better than and then I saw you putting more pressure on cardiac rehabilitation. So how do you think it actually should be?
So we don't have supervised programs in India. So there are supervised programs, and I think there are fairly decent enough guidelines available also to go by. But the intention is nobody's willing to invest. So I think we need corporates, we need larger chains, we need people to really look at it as a point of not just making money, but it actually adds lives to yours.
Yes, that is true.
So that's what we are looking at. So rehabilitation is something that has to come under the ambit of insurance. It has to be reimbursed. It is something that has to be endorsed by all our bodies, saying that it should become level of evidence class 1A probably. But the problem lies with, and after that, I mean, next is going to be generating awareness within your community, saying that why you should be on rehabilitation.
Correct.
I mean, the simple understanding is that you look at these blue zones, as I call it, longevity zones, the most all over the world. So it's all about community leveling. It's all about exercise, and they do it in a community fashion. So I find a lot of patients saying, "हाँ sir, tomorrow कल से gym जाएंगे." Wow, very good, very good. 2-3 महीने के उसके बाद उसका motivation कम हो गया, बोला कौन जाएगा. So I always say that you do it in a group, find people who are like-minded, because क्या होगा, after 3 months, when you start losing motivation, somebody might still be having a little bit more motivation.
Yes,
he's going to pull you out of bed and take you for exercise.
Correct.
So group therapy always helps. So as social human beings, it's very important to interact with people.
Correct.
So I find a lot of people, saying घर पे ही रहते हैं, किसी से बात नहीं करते. Oh, nowadays mobile is there. I think that's a big killer.
Yes.
I mean, so mobiles should go out of the house. People should go back to playing on the playground. They should go back to exercising. I mean, these are definite major, red flags, which I think we've been noticing amongst most of our patients, young patients, and and there's nothing I can do about.
That's the issue right now.
Oh
And
yes.
when you talk about exercise, are there any specific do's and don'ts in exercises? Because
So typically in heart failure patients, so I'll be very broad about it. I think we cannot be going to specifics right now, but the intention is that you cannot be doing a lot of cardio. That's not the intention.
Yes.
I'm looking more at strength training and muscle training
Okay.
only.
Okay.
So they are generally very safe.
Okay.
But the importance is the way you do it.
Supervision, as you said.
Yeah, so otherwise ऐसा होता है ना कि let's say you decide, so I'll give you a count. So one of my patients decided to go to the gym, and he sort of picked up the 7.5 dumbbell the first day,
Oh my God.
and he got himself nicely hurt. So and he comes back, his wife's screaming. He says, "Sir, आपने तो बोला इसको देखिए क्या करके लाया." मैं बोला भाई देखिए सबका एक तरीका होता है.
Correct.
So the intention, आप पहले दिन ही जाके 7.5 किलो का डंबल उठाओगे तो कैसे होगा? That doesn't make sense. So what you need to do is you need to have supervision. So I would say invest in a trainer for a few months.
Yes.
Learn the right way of doing certain
Correct.
exercises,
Correct.
because there's a motion involved also. I mean, you just can't do biceps and triceps and single arm rows just the way you feel like.
True.
Because then you will end up injuring yourself.
Correct.
So the intention is invest in a trainer for a few months, understand how to do your exercise as well, and then you can buy a bench at home. You can order dumbbells nowadays on Amazon. Do it at home. It's as easy as that.
Right. So I really had a very, very, very good time talking to you about heart failure, and a very insightful episode, I must tell you. So just one last powerful message on the occasion of World Heart Day that you would like to give for our viewers.
So I think the World Heart Day 2020, today this is the 25th World Heart Day we are actually celebrating. So I think it says it's don't miss a beat.
Don't miss a beat, yeah, is a campaign.
So
yeah.
I think in our fast-paced life, I think we're not living life often, and we're not really finding out whether our heart really skips a beat. So often you would want to skip a beat for things not just which is work-related.
Correct.
I think we should get beyond our mundane lives and look at, there are other things to cherish in life beyond work and money, and I'm sure we could be more frugal on certain things, and it's important to get out of your phone, digital media, go talk to people, exercise, eat the correct food, stop ordering on Swiggy and Zomato and Uber Eats.
Yes.
I mean, it's just about more health awareness. I think we as a country, we are still a very young country. The median age is still hovering around 30s, if I'm not wrong. It was probably 25 last decade. So as a young country, if you're not aware about your own health, you're basically going to end up only investing in health insurances.
That is true, yeah.
So I mean, that's, and you know what a calamity that is.
Yes. So thank you so much for being with us today, and we're really honored.
Thanks so much.
So to all our listeners, आज के एपिसोड से हमने जाना कि आपकी हेल्थ आप ही के हाथों में है. So don't wait for the warning sign to make the right choice. After all, it's one life and every beat matters. So if you find our videos informative, don't forget to subscribe to our channel on Instagram. It's One Life by Mankind Specialities. Until then, stay informed, stay healthy.